A very good morning or evening, whatever the time is there right now, to Professor Zainal and the fellow viewers of this video. My name is Marylen and Martin, BM23110052, Year 1 medical student, and in this video, I will be presenting about the female reproductive system, and the disease that I have chosen that relates to this system is the menstrual disorder. So I hope everyone enjoy this presentation. Okay, so let's begin the presentation with the anatomy and physiology of female reproductive system. So as we all know, the reproductive system is the only system in our body that can be classified into two types, which is the female and male reproductive system. So the reproductive tract in women is contained mainly in the pelvic cavity and perineum. So as you can see in the diagram, I have chosen 5 organs that plays a very important role in the female reproductive system. So the first one is ovary, where its function as the site for egg production, which is the process of oogenesis, and the ovaries lies adjacent to the lateral pelvic wall, which is inferior to the pelvic inlet. The second one is cervix. It has a tube that opens at the bottom, or also known as the external os, into the vagina, and at the top into the uterine. It is known as the internal os. So the cervix forms the inferior part of the uterus. It's shaped like a short, broad cylinder with a narrow central channel. So for the uterus, its function as the implantation of blastocysts. So during pregnancy, the uterus will expand superiorly into the abdominal cavity. And the uterus is located midline between the bladder and the rectum, and above the level of the origin of the uterine tube, it has a rounded superior end known as the fundus of the uterus. For the uterine tube, its function as a place where fertilization will take place, specifically in the ampulla. And the uterine tube consists of infundibulum, fimbriae, ampulla, and isthmus. And lastly, vagina. It is a copulatory organ and it acts as a canal for menstrual fluid. It is a distensible muscular membranous tube where it extends from the midline cervix of the uterus to the vaginal orifice, which is the opening at the inferior end of the vagina. Okay, so now let's move on to the histology of the female reproductive system. So as you can see, this is the picture, the microscopic picture for the uterine cervix, and these are the histology for the uterine tube. So let's begin with the uterine cervix. The uterine cervix shown is continuous with both the body of the uterus and the superior part of the vagina. The mucosa is lined by a tall columnar mucus secreting epithelium in its uterine portion, but note that there will be abrupt change to stratified squamous epithelium at its vaginal face. So for the uterine tube composed of 3 layers, and the innermost mucosa is a simple columnar epithelium. So there are 2 types of simple columnar epithelium. The first one is the ciliated simple columnar epithelium and non-ciliated simple columnar epithelium. So this is a zoom picture, zoom view. So for your information, in the ciliated simple columnar epithelium, when ovulation occurs, this will increase, the increased estrogen will make the cilia in the female reproductive tract to grow larger in size and work faster. And this combination will help to propel the egg towards the uterus. So now, let's talk about the menstrual cycle. So this cycle is part of our reproductive system and it helps to prepare our body for the possible pregnancy. So the average length of a menstrual cycle is 28 days, but however, a cycle can range from 21 days to about 35 days and is still considered as normal. So the rise and fall of our hormones trigger the steps in our menstrual cycle. Our hormones will cause the organs in our reproductive tract to respond in certain ways. Okay, so in the menstrual cycle, there are 4 phases. The first one is the follicular phase, next is ovulation, third is luteal phase, and the lastly is the menstrual phase. So let's begin with the follicular phase. So, the follicular phase begins when the hypothalamus sends a signal to the pituitary gland to release a hormone called follicle-stimulating hormone, FSH. This FSH will stimulate the growth of the ovarian follicles. So, as the follicles mature, they will produce increased levels of estrogen, specifically 17-beta-estradiol. So, the function of estrogen in this phase is that it helps to thicken the lining of our uterus. Follicular phase will reach the end when we begin to ovulate. So now, let's enter the ovulation phase. So during the follicular phase, an increase in estrogen levels eventually will trigger a surge in luteinizing hormone. This surge, along with increased follicle-stimulating hormone, FSH, is very important for the release of the egg, which is ovulation. So during this phase, the ovary releases mature egg, and then the egg will travel along the fallopian tube towards the uterus to be fertilized by sperm. So after the ovulation phase, we will enter the luteal phase. So after the release of the egg during ovulation, the ruptured follicle transforms into a structure called the corpus luteum. The corpus luteum will release progesterone and some estrogen as well. So there will be two situations that may occur during the luteal phase. The first one is if pregnancy occurs. So if there is pregnancy, the developing embryo will produce human chorionic gonadotrophin HCG. And for your information, this is the hormone that will be detected by a pregnancy test. So, the reason why the developing embryo will produce HCG is to maintain the corpus luteum. So, what if there is no pregnancy? The corpus luteum will then shrink, leading to a decrease in estrogen and progesterone, ultimately will result in the onset of the menstrual period. After luteal phase comes to an end, menstrual phase begins. It begins when the egg from previous cycle is not fertilized and pregnancy does not occur. So during this time, the hormones estrogen and progesterone drop. The thickening of the lining of uterus is no longer needed, so shedding will occur. Blood, mucus and tissues are released from uterus via the vagina. So that's all for the menstrual cycle. So now let's move on to menstrual disorders. So there are 4 types of menstrual disorders: dysmenorrhea, menorrhagia, amenorrhea, and oligomenorrhea. So the first one is dysmenorrhea. Dysmenorrhea is severe and frequent cramps and pain during menstruation. It may be primary dysmenorrhea and secondary dysmenorrhea. Primary dysmenorrhea is due to abnormal uterus contractions. It can be due to chemical imbalance in the body or such as chemical prostaglandin. Secondary dysmenorrhea is due to medical conditions such as endometriosis, and the symptoms for dysmenorrhea is cramping in the lower abdomen, low back pain, and pain radiating down the legs. Next is menorrhagia. Menorrhagia is heavy or prolonged menstrual bleeding, and it can be due to hormone problems or conditions that can affect the uterus. Example of hormone problems is imbalance of estrogen and progesterone, and problems relating to uterus are cancer, miscarriage, and the usage of IUD. And the symptoms of menorrhagia is when we bleed longer than 7 days. Next is amenorrhea. Amenorrhea is the absence of menstruation, or in other words, is the missing of one or more menstrual period. There are 2 types of amenorrhea. The first one is primary amenorrhea, which is the absence of menstruation in someone who has not had a period by age 15. And next is secondary amenorrhea, which is the absence of 3 or more periods in a row. Amenorrhea can be due to hormones, anatomical problems, and pregnancy for secondary amenorrhea. And the symptoms are, depending on the causes, can be pelvic pain, milky nipple discharge, and hair loss. Lastly is oligomenorrhea. Oligomenorrhea is having infrequent menstrual periods, and it can be due to conditions that causes hormone imbalance in the body and infections and structural abnormalities in our reproductive organs. And the symptoms are missed and delayed periods, and besides that, depending on the causes, acne, headaches, and vaginal discharge. So we have come to the last page of this presentation. And as you can see, this is Dr. Victoria Orlova. She is a obstetrician gynecologist, and she has worked professionally for more than 10 years. She is a member of the Ukrainian Association of Reproductive Medicine and the European Society of Human Reproduction and Embryology. And in 2019, she was awarded the Order Scientist of the Year by the Ukrainian Federation of Scientists. So she is who I inspired to become. She is my idol, and I hope one day I can be like her in my own way and my own achievement. So to end this presentation, I would like to share a poem by Nikki Tajiri. No one else sees it, no one else wants to. Only she can see the beauty in her blood. So that's all my presentation about the female reproductive system. Thank you and bye-bye. With love, Marylen.